Dr. Richardson on Call, brought to you in part by the Atlanta Clinic of Preventive Medicine, William Richardson, MD.
This program is not being used to make diagnosis, administer treatment, prescribe medications, or order tests. The information contained is provided as an educational service. This program is not a replacement for the relationship you have with your healthcare provider. If you have concerns about your health, please contact your healthcare provider's office immediately.
Hello, ladies and gents. This is Andre 3000, one half of the group Outcast, and you're listening to Dr. Richardson on Call on WCLK 91.9 FM.
Hi, and thank you for listening to what was at the time Dr. Richardson's very popular and informative holistic, preventive, alternative health talk radio show, designed to save lives, prevent disease, and reverse disease. Furthermore, if you are interested and in need of a holistic alternative medical doctor, you can reach Dr. Richardson at 770-419-4471. That's 770-419-4471. And be sure to visit our website at acpm.net. That's acpm.net.
Hi, I'm Dr. William Richardson, and I'm inspired and honored and truly welcome you to this edition of Dr. Richardson on Call, where the second and fourth Wednesday of every month from 6 to 7 p.m., we will take in-depth, stimulating looks at the major health issues facing our community today. My friends, the mission of this health talk show, Dr. Richardson on Call, is to reverse and prevent disease as well as save lives. On this show, we request, we encourage, and we really demand your participation. Call us and ask your important questions and give your valuable commentaries when we open up the phone lines. Again, I'm your host, Dr. William Richardson, a board-certified medical doctor with over 25 years of experience. My role on this show is to facilitate our listeners in the how and why of making intelligent health choices in quality medical care, disease reversal and prevention, nutrition, diet and supplements, cleansing and detoxification, immune system enhancement, and many other lifestyle and environmental factors. Also, as always, I'm joined in the studio by my brother John Richardson, who is the writer, researcher, and executive producer for this show, to whom I owe many thanks. Thank you, Brother John.
And thank you, Brother Dr. William Richardson. And welcome out there in Radio Land, as I, too, John Richardson, am also honored, inspired, and highly motivated to assist Dr. Richardson in expounding the benefits of preventive medicine, holistic techniques, lifestyles that are healthy, diet, nutrition, stress management, as well as complementary and alternative therapeutics. And we invite you to join us on our next show at this same time, Wednesday, October 7th at 6 p.m., where we will be discussing how to prevent and reverse arthritis and osteoporosis. Yes, my friends, we will dispel the myth that arthritis and osteoporosis are an inevitable result of aging. They are not. What causes the body to attack itself during the process of rheumatoid arthritis, which is categorically referred to as an autoimmune disease. We will look at why is having a porous digestive tract a major culprit in the rheumatoid arthritis process, and how fasting can correct this problem. How is it that atherosclerosis and a high-fat diet are big hindrances to the healing of rheumatoid arthritis? What about heavy metals such as cadmium, lead, arsenic, mercury? What about aluminum, which is a light metal, but it's an environmental pollution aspect that we look at? What about drinking water? What role do these environmental toxins play in arthritis? What are the latest suppress the symptoms conventional medicine approaches that we have for suffering with arthritis, such as steroids, methotrexates, aspirin drugs, which do not cure arthritis, but do damage and weaken the liver, digestive tract, immune system, and nervous system? Why is exercise essential to prevent osteoporosis and arthritis? Did you know that 40% of the U.S. elderly population develops an osteoporosis-related fracture, which is serious and life-threatening? Why is it, contrary to popular opinion, that drinking milk and eating a lot of dairy products actually cause, not prevent, osteoporosis. Did you know that age-related bone loss in America starts in your 30s, so that it is a big mistake to start worrying about osteoporosis at age 50 during menopause? Why do women develop more osteoporosis than men? Why is it that most calcium supplements do not work to prevent osteoporosis but actually appear to cause it? We will examine the typical American diet and lifestyle of high fat, high protein, low fiber, no exercise that causes both osteoporosis and arthritis. And finally, we will discuss a course of action that you and I can do to prevent and reverse arthritis and osteoporosis. So, folks, we really insist that you join us next time, next show, Wednesday, October 7th at 6 p.m., so we can share with you the secrets of preventing and reversing arthritis and osteoporosis. So be sure to join us same time, same station. Thank you.
We're going to look forward to that show very much.
Yes.
But now I'd like to quickly turn to our topic for this evening, and that is spirituality and psychoneuroimmunology. Ology is the study of the immune system and its relationship to the thoughts, to the mind. And of course, the neural system is merely the communication device from the mind to the body. So, in other words, we're going to look at the tremendous role that the spirit, mind, and emotions play in regaining, maintaining, and or building physical health and well-being. And let me make it clear here and now that as powerful as conventional medicine may be, and as powerful as natural and dietary approaches may be, we should understand that a lasting prevention, improvement, and cure of almost any illness is most deeply and fundamentally rooted in emotional, mental, and yes, to our spiritual states of health and values. An example of this would be, do people catch colds or flu simply because viruses happen to be around? Or do we come down with the flu cold because our resistance is down and our immune defenses are in a weakened state? And then again, why have we been neglecting ourselves so much in the first place to allow our immune system to go down? Deeper still, do you feel loved by other people, by God, and do you love yourself? And deeper still, what purpose is this illness serving? And perhaps, what is this illness substituting in life for? A fundamental need of yours that's maybe not being met? Practically speaking, this line of reasoning can be used for almost any illness, whether it's colds, flu, cancer, heart disease, obesity, digestive problems, depression, so on and so forth. Unfortunately, I had to realize a long time ago that my formal medical training has generally ignored not only nutrition, diet, lifestyle, and exercise, but perhaps most importantly, the overwhelming connection between our psycho, spiritual, emotional state of health and physical state of health and or disease. Yes, my friends, modern medicine has considered the mind unfathomable, excuse me, emotions too intangible, and the spirit totally untouchable.
Ouch.
Now, I want us to look beyond this, to go beyond conventional approaches to treating disease, to go beyond merely defining and categorizing illness on a purely physical level, and to go beyond simply finding the most effective pharmaceutical agent or surgical procedure or herb to provide only relief or suppress the symptom. As a holistic preventive medicine physician and doctor moving into the 21st century, we must realize that the true health is really not found in a hospital, a bottle of pills, or a doctor's office, or even a health food store. But health has its fundamental root and beginnings in the mind, the spirit, and the emotions. Yes, there are even many unhealthy and unhappy vegetarians or exercise enthusiasts or anything else. Mm-hmm. The truth is that we must learn to balance and blend and unite our physical, mental, emotional, and spiritual in an all-out effort to truly love ourselves on all levels. Moreover, in recent years, medical science has called more and more into question the relationship between the mind and body. As a result, over the last decade, a new field of medicine has been emerging, again, psychoneuroimmunology, the study of the relationships between the mind, consciousness, the brain, nervous system, and the immune system. By observing changes in the immune system in connection with various stressors, emotional states, and personalities, science have begun to document what behaviors scientists have been telling us for centuries, and what medicine men, shamans, and faith healers have known for millennia. That is, that our minds and emotions, what we think and feel, how we perceive and react to various situations, and what we believe in have a profound effect on the health of our bodies. On a technical note, if you'll let me indulge for a minute, the more we learn in the field of psychoneuroimmunology, the more it becomes clear that the dualistic Cartesian distinction between the mind and body is no longer useful or even accurate. Some scientists now feel that a more unified term of body-mind is far more appropriate. Research has demonstrated unmistakably that functions and substances we previously thought were relegated solely to the functioning of the brain occur throughout the body, even in the cells of the immune system. Scientists are both shaken and excited by the realization that what we think of as mind may not necessarily be brain function, but rather an organizing glue, so to speak, that maintains a balance, a wholeness among various body-mind components, better known in the world as spirit or consciousness. Examples, Deepak Chopra has said and researched many of these things. For example, what astounds researchers is the recently discovered fact that the cells of the immune system are capable of producing all the brain neuropeptides or brain chemical or proteins themselves. In other words, the immune system not only receives messages from the brain, but can also transmit detailed information back to the brain. What this means is that the immune cells all throughout the body can think, feel, and communicate. Furthermore, when this immune system is suppressed, it allows infections and cancers to occur. When it is overstimulated, for instance, by continual responses to stress, it will begin to attack the cell, producing possibly autoimmune conditions such as systemic lupus erythematosus or rheumatoid arthritis. And of course, that's more likely in this particular culture for various reasons. Also, your immune cells know when you're scared, depressed. They know when you're angry. They know when you're happy. They know if you're in love or desperately lonely. They can assess what you're thinking and feeling not only from the neuropeptides and other biochemicals in the bloodstream, but from nerve fibers that originate in the brainstem and the spinal cord that communicate directly to the thymus, the spleen, the bone marrow, and the lymph nodes. Bottom line is every cell and atom, for that matter, in your body thinks, feels, and communicates and determines your physical state of health depending on your psycho, spiritual, emotional state of being. I can tell you as a practicing physician, I see this every day in my practice. Numerous other examples exist that illustrate the power of one's attitude, character, and spiritual perspective. You may have read Norman Cousins' Anatomy of an Illness, which relates the story of the author's recovery from a terminal illness through determination and laughter. You may always also be familiar with the work of Gerald Jampolsky, author of Love is Letting Go of Fear and Teach Only Love. At the center of attitude healing, Jampolsky has taught and inspired children with terminal cancer to heal themselves. In Love, Medicine, and Miracles, and in Peace, Love, and Healing, Bernie Siegel, MD, relates how he teaches his cancer patients to activate their own healing mechanisms. Equally significant are recorded data that verify the ability of the experienced meditators and individuals adept at prayer, biofeedback, self-hypnosis, and other similar practices to control pain, blood pressure, bleeding, heart rate, infection, and other involuntary functions at will. In other words, there have been yogis that have been documented to slow their heart rate so low that they have several beats a minute instead of 60, that they have 1 or 2 breaths every minute instead of 14 to 16. There is an overwhelming anecdotal evidence and some scientific documentation that through conscious and unconscious means, through our thoughts and emotions, attitudes, beliefs, personalities, imagination, and creativity, we can enhance our immune response and resist or overcome illness.
All right. Thank you very much, Dr. Richardson. Folks, for 3 years now, we've been going over week after week after week after week after week, diet and lifestyle and nutrition and stress management and chelation therapies, and people are interested in that. The mercury in your mouth, environmental pollution, a lot of things external,
Sure.
external, and they're important. You know, you want to know and be educated about the external pieces that we're involved with while we're on this plane. However, this show is going to open up the internal. That is the mind, the spirit, the emotions, your belief in a higher force, your creativity, that which you really are, that which you really are. And, you know, that's what we're looking at. So, you know, basically, we have some tremendous guests, which we're going to introduce in a minute. We're just kind of kicking this around for half a second here, but we're going to get to these guests. You folks are going to love these guests, man. You know, there's all type of techniques we're talking about.
That's right.
You know, we're talking about what? Meditation, Tai Chi.
Yoga, creative visualization,
We're talking about prayer, chanting.
self-hypnosis is excellent.
We're talking about laughter therapy. I know when I was having a challenge, my deal was watching the Beverly Hillbillies. I believe I've seen every Beverly Hillbilly. And then Opie. Opie, what is that? Opie and Andy? Mayberry.
Andy.
Mayberry.
RFD,
RFD, right.
Yeah.
I'll be watching those things because I'll be laughing, and then there wasn't much dirt in it, so to speak.
Yeah.
There were other things.
Every
but-
patient who comes through my doors, I always try to get to laugh, to enjoy themselves. And if they don't, I expect them to cry, but don't just sit there with no
That's
emotion.
right.
Do
That's
one
right.
or the other.
That's right. And in laughter and smiling, Mantak Chia says that there's actually a honey-like substance that's emitted in the internal organs, and it's actually therapeutic to the body. But when you are angry or you're upset or you want to hurt someone or something like that, poisons are emitted in the body to give you a death signal. So we're
right.
talking about a lot of stuff here, and we're going to introduce these guests in a minute. But there's a lot of books on these things. We have a book list and
Sure.
also a resource list. Dr. Rich said, you know, we have these books in our clinic: Dynamic
Sure.
Laws of Healing, Dynamic Laws of Prayer, Dynamic Laws of Prosperity. You Can Heal Your Life, Louise Hay. What about
How to meditate.
How to meditate?
Bernie Siegel.
Bernie Siegel, Love,
Love
Medicine,
Life,
and Miracles.
yeah.
There, Course in Miracles, Miracles by Stuart Wilde, The Force, all these things. Road Less Traveled, Scott Peck, and there's a long list of books on spirituality and this subject and how to develop these things. And ultimately, if we were fully developing our consciousness, we wouldn't necessarily need a book. But they have books, and we can use them as
And the
resources.
sacred, the ancient texts, the Bhagavad Gita.
Bhagavad Gita.
Say it again.
Bhagavad Gita.
Bhagavad
Gita.
Gita.
Right.
All of those types of books have the same knowledge in. These are really just repeats of that ancient knowledge, because the
That's
ancient
true.
people already knew this
Yeah,
and
they
used it.
They made it more a central point. They didn't have 220 stations and all this other type of thing. So,
That's right.
folks, we're going to jump into this, and we're going to move into our guests. We've got some high-powered guests here. We're going to get them involved, and then we're going to get you, the public, involved. You can call in. And how should we go into this, Dr. Richardson? Should I take one guest and you take the other
Oh,
guest,
sure.
and then
Let's
let
do
the
it that
guest
way.
speak, and then we just go after it here?
Sure.
I will introduce the first guest, and then she can say hello and say whatever she needs to say. Then we'll introduce the second guest, and then the same thing, and then we can just see what happens. I'm
All
going
right,
to
then.
introduce Reverend Dina Jones. Reverend Dina Jones, we're happy to have her. First of all, Reverend Dina Jones had sponsored this show, and we really appreciate that. And she has a spiritual center, which is actually down the street from our facility, 1655 Peachtree. And they have a whole lot going on there. And she is a reverend, a spiritualist, and a writer, and many things. And she has a book, and it's called Evolving into Knowingness. And I have read the majority of this book, Dina. I don't know if I've read every word, but the majority. I was going through it, and it's very interesting. And you give your testimony of things you went through when you were coming up, and very, very, very enlightening. And I appreciate reading that. And so in her spiritual center, she has spiritual development classes, yoga classes, meditation classes, lack recovery classes, Course in Miracles, prosperity training, lots of things. And we are so pleased to have her here to share in our show of spirituality and psychoneuroimmunology. So, Dina, welcome.
Thank you. It's exciting to be here.
Oh, great.
Extremely, extremely. It's wonderful to see doctors moving into the area of spirituality. I think that the biggest thing to remember is, of course, we are spirit first, and
Yes.
and our body is actually is of spirit as well. But the
Yes.
spirit controls whatever goes on in the body.
Yes.
So that's the key thing to remember. If we keep that in mind, then we know we can definitely heal anything we desire, because spirit cannot be sick.
Yep. I like that. Definitely. She didn't say maybe if we do this or whatever. She said we definitely can be healed because our spirit can't be sick.
Right.
Yeah, that's what we're looking at here. What would you give folks listening to this show on spirituality and psychoneuroimmunology? What might you say in terms of a person that's having a challenge beyond what you just said, whether it be resources or come to your facility or whatever? What would you say to the people that they need to hear at this time?
I think first you have to realize that you truly are a spirit, which means that you're one with God, and of course you cannot be sick in your true essence. So if you're experiencing something right now, first recognize that you truly are spirit, and whatever you're experiencing for a reason. But of course you can definitely move through it. And secondly, perhaps begin to meditate. I've heard of people even curing themselves of cancer by walking on the beach. Once again, just changing the environment and being more relaxed, releasing the stress that's around them. So a lot of times we have to change the outer, what we're doing daily, in order to allow our bodies to heal, our consciousness to evolve, and to go to a different frequency, which brings about healing.
Yeah, I've heard you lecture, and you would say something like, I don't think you watch the news. I think you outpicture your entire day before you even start. I've heard your lectures and that, you're outpicturing and futuring the whole deal before it's even happening. And so that's some powerful techniques, which I know you employ.
Yes, visualization, of course, is very important.
Yeah.
So you have to be able to see it if you're going to experience it.
Yeah.
So
Yeah.
very, very important.
Yeah. And like we were saying, there's many classes and books and resources to train the folks on it. Now, I'm not talking about Channel 11, Channel 5, or Channel whatever. I'm talking about some of these centers we're talking about and the people that know this information, and we try to train in our clinic or refer. It's very important. It's fundamental to the ultimate healing. You can take whatever herb, pill, medicine, procedure you want. If you don't get what's inside straight, it's just going to cover up the problem, a Band-Aid type of approach. Temporarily, something else will happen. So, all right, Dina, we're going to thank you for those comments. We're going to let you participate with us throughout the show. Dr. Richardson, would you like to introduce our next guest?
I'm very happy to introduce our next guest. Our next guest is Dr. Jewel Pookrum. And are you originally from Detroit?
Yes.
Okay,
Oh, wow.
originally from Detroit,
Wow.
a practicing physician. Many of you have heard of Dr. Jewel Pookrum.
Yep.
She's an author. She is an extraordinary woman and physician and healer. And I admire her because of her grasp of psychoneuroimmunology from many years ago. It's something a lot of physicians would have. First of all, most haven't even thought of it that much as deeply as we're even discussing here, but very few have grasped it to the point that you have, and I'm really excited about that. Now, of course, you went through, the herbs and everything, but this seems to you to be extremely important. Tell us about that.
Well, thanks so much for being here. I was supposed to be here a while ago, a long time ago, and so we finally
Yeah.
got here.
Uterine fibroids, right.
So I'm really glad to be here, and it's so nice just meeting, ministers or reverends, that really want to do their work. Okay, I think Dr. Richardson and I were talking about this, that we had so much to do because we felt like we had to be the minister and the doctor, and we had to do all these things and do what the church is not doing. But I got interested in psychoneuroimmunology when I recognized that was the true pathway for healing chronic disease. And having had the challenge with cancer myself, I had a very virulent form of cancer. And by the time I diagnosed it, it was already in its metastatic state. So it's kind of like a little joke that I have. In the internal medicine field, we usually take a position that whoever makes the diagnosis then has the right to treat. Okay, and so my thing is that if I have to diagnose, then I treat. And so I asked my colleagues to, no more opinions, recommendations, because they didn't make the diagnosis. I did, so I was going to have to figure this out myself. So having been a surgeon, I definitely was not interested in chest tubes and biopsies and all these things. And the kind of disease that I had, if you biopsied it, even increased the rate of spread. So that was, a failure mark for anybody who suggested that. So I recognized that I was in a dangerous place and I need to get out. So at that point, I really had to recognize that I had shut the door on conventional methodologies for me, because I definitely was in the inside looking out and knew that there was something different. So just simply said, I was already eating well. Okay, I was, very abreast of macrobiotics, herbs, and diet and exercise. I was jogging. And so I recognized that here I am sitting here with this tumor and I'm having hemoptysis, or, coughing up blood. So I recognize that we need to go a little further. And to just show you how spirit works, or the creator, as I termed it, works, is that I said, well, good, if I go on a really good fast, a long cleansing fast, colonics, the whole thing, that'll really get it straightened out. So I fasted for 30 days. I had studied with Dr. Alvina Fulton, who, taught Dick Gregory all his stuff. So I went on one of her programs, 30 days, colonics, 2 to 3 a week, and 30 days later, went back for a chest x-ray, and the mass was 40% bigger. So therefore, I got real clear that I was being asked to do something real different, and we got busy moving into a different arena quickly. You said that's break time?
Yeah, we're going to break. I know right. You got the folks on the end of their chair. That's what we're dealing with. See, this is dramatic radio we're dealing with here. So when we come back, we're going to let you finish this piece. And then, and then we'll finish, but we're going to break right now. And we appreciate that.
Yeah, it's time for a break. And, stay tuned. We will be back with the end of that story.
And more stories.
And more stories. And we'll be inviting you to the phone line in a minute. This is Dr. Richardson, Dr. Polkram, Brother John, and
Reverend Tina Jones.
Saying, come on back. We'll be right back. This is WCLK Community Health Forum 91.9. We'll be right back.
Hi, and thank you for listening to what was at the time Dr. Richardson's very popular and informative holistic, preventive, alternative health talk radio show, designed to save lives, prevent disease, and reverse disease. Furthermore, if you are interested and in need of a holistic alternative medical doctor, you can reach Dr. Richardson at 770-419-4471. That's 770-419-4471. And be sure to visit our website at acpm.net. That's acpm.net.
So we are going to get back to the show, and a little bit later on we'll open up the phone lines, but we want to get it on with our guests in terms of healing and psychoneuroimmunology and spirituality. So let's go back. So we're hanging on the end of our chair here listening to Dr. Polkram. Now, you had done all the colonics and fasted and all of that, and the tumor went to 40% of the size.
Right, bigger. Yes, bigger. And it's something I can't describe to you. Only a cancer patient can know the level of fear, that kind of sensation that one has in one's body. I have never, ever felt that kind of sensation before, but all I know is that I needed to get rid of it. So therefore, for the third time, there was a invitation to go study with the Native American Indians, because my thing is I'm too busy, I've got children, whatever else, what am I going to learn from them, and so I looked at my desk and here was this third invitation from them, and this time I didn't toss it in the trash. Something said go, so it was like a weekend powwow. And so I went there and I was just astounded, because they talked about everything relating to your thoughts, your emotions, and how this affects your body, etc. I mean, I never heard this before. These were just my own internal thoughts that I would have at times, but I just really never heard this as a cultural status on healing. And so at this particular tribe, their whole position is that we assess what's happening with you emotionally. We also assess what's happening with you from past lives. I mean, so they had this all hooked into the DNA. And then from there, we give you the option of seeing what's being asked of you from this illness. So their presentation was that any illness that you have is a learning experience for you, and a chance for you to actually ascend into your real self. So they're saying that this is a deviation far from what your genetic ID is, and that this is an opportunity for you to decide if you really want to be the real you or not. And if that's the case, we let you see it. They use what they call like a mirror imaging technique, and then we treat you with the herbs to help the body then rapidly fall in state with what you've decided in consciousness. but that's the last resort. That is not the first thing, and this is what it's primarily focused on. So, I mean, I remember spending that whole week in tears, and it just really reorientated my whole position. So I recognized, I looked at my life. It wasn't what I really wanted it to be. I had to make drastic changes in my life. I immediately made changes in just my whole persona. You know, I had been taught that, you know, as a female position, you know, and especially from a Eurocentric perspective, you know, navy blues and maroons and, you know, taupes and things were not offensive colors, and that, you know, these were the things that you were to wear. And, you know, and I'm a sequin feather girl. So my thing is that we threw all those clothes out. We got us a whole new wardrobe, etc. We just got a whole new presentation on how we wanted to present ourselves. And so the key here is that I immediately decided that I was going to be the me now that I had always wanted to be, because we're always taught that we should postpone ourselves for reasons, for money, or for this, or for that, etc. And I said, no, the ideal me as I perceive myself mentally, emotionally, physically, spiritually, and sexually is coming to the forefront now. And as soon as I could define what that was, and immediately for the rest of my life begin to live one aspect or every attribute that I could define, within a matter of 9 months, when I finally went back, because I was having so much fun now, because I was, you know, wearing feathers and sequins to work, face paint. I was doing, I was having big fun. I was doing all kind of stuff. When I said, okay, I better go back and just check and see how this is doing. So as you know, we call these things fireballs, right? So I said, you know, these fireballs probably are all through my lungs, but it doesn't matter because my confidence level was such that I knew I could handle it, you know? So I just wanted to get a hand on what happened to me physically, because I felt like a juggler. And here I was juggling my mental self, my emotional self, and my physical self. And you're responsible for all of these aspects of yourself. None of them can ever hit the ground, right? So I had to then go back. And so when I went back and we took my chest x-ray, my friend and I did this. We were the only people in the clinic at that time. When they stuck my chest x-ray up on the view box and I glanced at it, I recognized it was normal, and I immediately asked the technician to give me my chest x-ray, because obviously they had given me the wrong films. So he said, no, we haven't taken any x-rays today. You're the first person we turned the developer box on for. You're the only films that are in there, and so therefore those are your films. So when I saw that everything was completely healed, it was interesting again. I was so frightened. Because again, you know, most people would like, you know, be jumping for joy. I was frightened because, see, I recognized at that point in time that here I was, being unconsciously competent. And when you're unconsciously competent, you can easily get back into the state you were before. So therefore, I had to have answers. Exactly. I had to have answers, because it's like, I don't ever want to go back through this again.
Right.
So I don't even want to breathe until I know what I should be doing. So what did I do? I kept a journal, and I stressed this for all of my patients who were seriously ill. I went back to my journal, and I saw very succinctly that there were 5 stages that I went through to create this healing. First stage, very simply, listen very carefully, jot this down, is that you have to take responsibility that some way, somehow, you have been actively involved in creating this disease. If you want to play victim, you will not be able to change the circumstances. So you might not know how you contributed to what you have, but you have to take responsibility. Secondly, you have to then decide if you really want to continue being sick, or if you really want to live or be well. And in my case, we're looking at a life or death issue. So did I want to live or die? So I had to get very clear about whether I wanted to do that or not. Now, for my patients, I tell them, if you want to live, then we move to stage 3, because there's a stage 2B. But for those who want to live, we move to stage 3. Stage 3 is that you design a plan that you believe, not what anybody else believes, the mother, the husband, or whatever, that you believe that you will follow 100%, that will help you get well. Okay, you cannot decide that because the doctor tells you that everybody else should have this surgery or whatever. It's like, if you are afraid of surgery, if you know that you do not want chemotherapy, I don't care what statistics they cite, that will not work for you, because you are not in alignment with it psychologically. So you have to devise a plan that you will honor 100%. Thirdly, once you get on your plan, then fourth thing is that you have to identify the ideal self. Okay, if you could just sit down and totally rewrite your life, what would you be like mentally, emotionally, physically, sexually, and spiritually? And then you get the birthday. The birthday is that from whatever day you pick from that moment on, you are dedicated to live the ideal self for the rest of your life. So for my birthday, I got threw all my old clothes away. I got new wardrobe. I got a new apartment. We did everything because ritual is very important neurologically because it lets the cells of the body know to prepare for major change. Do you understand that? That's extremely important. You must have a ritual in this because that lets the body know that, look, we're resetting you, we're recalibrating you, we are expecting different things now, and the chemicals that come from the brain let the body know that this is what's happening so they can immediately be agile to make the switch for the new neurochemicals that you're going to create because you're now eliciting new behavior. So that's why when I decided that I was going to live my ideal self, that I was going to be happy every day, I was going to speak to people regardless of whether they looked at me like I was crazy because that's how I am, etc. Then 9 months later, and I don't know when the tumor really healed itself, I just know that when I decided to take responsibility and not neglect my physical body anymore because I didn't do anything for that, I was really working on the mental and emotional body, it was already gone. You would have never known that I ever had that disease. Blood levels for the HCG and everything were normal. That's how we monitor this tumor.
Yeah.
So that's when I was able to start really putting together a successful program for cancer. And this is the biggest problem with this disease is that the patients are not given the mental and emotional nurturing that they have to have for whatever is done physically. And this is why the disease cannot be eradicated because it is a psychosocial imbalance. You understand what I'm saying? That is finally manifesting in the tissues. Okay, you understand what I'm saying? And that's just it. And I'm a
What was
living
the
witness.
fifth?
Huh?
The fifth.
The fifth one is actually living out the ideal self. Okay, we define it as the fourth one, and then finally we live it for the rest of our lives. And so therefore, the support groups, okay, to be able to help people make these transitions. I've had patients that have died because they could not see themselves making the transition. Let me give you a story real quick. Had a lady with ovarian cancer. She was a Buddhist and she chanted and, her ascites went away and everything. She's even able to, make a world trip, But she stopped chanting. I think another trauma in her mind happened. Her daughter or something got seriously ill or came down with leukemia. She stopped all that. Then everything blew up again. But this time, when she tried to get back, she couldn't get there. So working with her, what was the real issue here? Well, every disease has a signature, and that's why Louise Hay's book is so wonderful about the psychological implication for every organ, okay? Well, ovarian issues always deal with your incapacity to see that you are the creator of your existence, okay? So therefore, same thing with testicles, okay? So therefore, this lady was not willing to recognize that the kind of life that she had, she was creating it. Anyway, as the story goes, she recognized that the husband and her should not have been together and should have dissolved this relationship for 30 years. However, he was head of the household. He had all the money. She had never had a job before, etc. So she felt that at this time she could not ask for her independence because she did not have a connection to the source to recognize that it has nothing to do with age, that any time you want to do what you were created to do, everything will come to play for you. And because she felt that she had to stay there, she perished.
Okay.
Awesome.
Well, that's part of the story, I'm sure. And Dr. Pulcrum has accessed a lot of things from visualization to affirmations to looking at your life to just a whole lot of things that you can be trained on and you really need to get serious about. And this not only applies to health and physical fitness and cancer and chronic degenerative illnesses, it also applies to finances, relationships, your whole entire life being on this plane. And that's what we're dealing with here. We're not just talking about popping a pill, popping a herb, going to the doctor. Again, health is not found in a bottle. It's not found in a hospital. It's not found in a doctor's office. Health and abundance and love and joy and peace is found right inside. It's your internal health, and that manifests the external health. And that's what we're dealing with, folks. And we appreciate the contributions from Dr. Pulcrum and Reverend Jones. And so, folks, what else should we do here? Should we do a bonding affirmation here over the air? We want to do, folks. We want to do a little healing over the air now. And we have a group of things we'd like to say here, and maybe we'll go to page 2, since some folks were discussing page 2 as important.
Oh, yeah.
There's a lot of things you can do: faith, prayer, affirmations, meditation, all this type of thing. But you have to know what it means. And I mean know, not know what the words are saying or understanding definitions of the words, but know, you know. As Dina says in her book, evolving into knowingness, you know, knowing. That means you know it. There's not much doubt in there. So, folks, let's read all this together.
Right. Can we hold hands?
Okay, we will
Get
hold
the
hands.
power together to come
gonna-
through the airways.
We're going to get some energy going here. We're going to read this slowly, folks. And this is on prayer. We want you to listen closely, bond with us over the airwaves, and let's do a little healing right here and now. So let's begin. This is about prayer. Begin.
Prayer is nothing more than coming into alignment with the higher nature of individual being to release into expression that which already is. We already have it all. We have it now.
But do we know it?
Our assignment is to develop a higher degree of realization of who and what we are, so that we can serve as a steady and bountiful outlet of the flow of perfect expression of that which already is. We must strive to not fall into limited thinking that we are less than divine, inferior beings, sinners, where we have to bargain and negotiate with God. It is not necessary to squeeze, beg, or coerce the power out of God to zap your problem. The power is already available and flowing, just as electricity is always available on the planet Earth. You just have to harness it and become a proper vessel, channel, medium for it, and eliminate blocks and obstacles.
All right, that's what we're talking about, folks. I hope you heard that over the air. I want to read one thing about faith, and we may have a go back into a little discussion here, and we may open up the phone lines here. It's getting late in the show, but this is a little bit of a different show. We're sharing with you. What I'm just going to read very quickly is faith, and it's out of the Bible, but an enhanced version of it, if you will. Well, fact, let's all read it again. Let's all read this again. This is faith, which would come behind the foundation of prayer. If you pray without faith, it's not going to mean anything. So you want to know what faith means. So let's tell them what faith means. Faith is the
Evidence of things thought about and believed in with conviction, knowledge and truth, and the substance of things not seen,
That's the
Spirit. Your faithful thoughts generate everything you see, perceive, and experience.
So get that faith straight, all right?
Yes.
And we're not talking about blind faith. We're talking about knowing faith. There's a lot of aspects of faith. So, folks, what else do we need to say on this subject of healing, psychoneuroimmunology, and spirituality before we maybe open up the lines and take a phone call or two?
Well, I
You know
think Dr. Jones has really hit it right on the head,
Yep.
and this is very important. Please recognize that you and the creator of all things is the same thing. And, you know, I'll tell you a little story. It's so cute. When it finally dawned on me just by reasoning, okay, that the creator and I were the same thing. I mean, it's like I was like walking around like a turtle with my head drawn in the
Right.
shell, because I was like, oh my God, this is a heresy thought. You know, it's like, you know, because we're just taught that that's always something out there and
Right.
you're down here.
Yeah.
But when I recognize that there is no separation
Right.
and that I'm looking at the creator, when I
Right.
look at me,
Right.
it took me 2 weeks to get used to that. And to really, I was like thinking
2
this,
weeks
and I
to
was
pull
like,
your head back out of your shell.
yeah,
Is that
because
what-
I was like, gee, you know, it's like, it's so awesome and
Right.
profound, but you know, how do you internalize something that has already been right there?
Right.
You know what I'm saying? So I'm just saying that I think that I know that people miss this and that they may have many issues in not accepting this, but it is crucial at this time that you must recognize that you and the Creator are the same, which means that obviously how would I dress the Creator? How would I feed the Creator? How does the Creator speak? How does the Creator behave?
What type of relationships with other people would I have?
Because now you get a real reasoning for your behavior, not what somebody else thinks or what's cute, but it's like being the Creator, what I'm supposed to do today, what should be my presentation.
Respect
Dr. Jones?
yourself
Exactly.
like you would respect the supreme being.
Exactly.
Reverend Jones? Yeah.
We looked at Deepak Chopra, at least talked about Deepak. I know in his book, Quantum Healing, he talked about how the actual body regenerates itself in a year, which means that if there's diseases carrying from year to year, it has to be because of the thoughts. And once again, our thoughts do create. We are the nucleus of God, which means that we actually move the energy to create whatever we so desire. So lack of awareness of who we are and that we have the creative abilities, what actually causes almost actually does cause every disease, as we call it.
Can I say one freebie? One freebie is flowers. This helps so much. So if we want to talk about an herb for the emotions, flowers. And you know about Bach flower remedies.
Right.
Okay.
Well,
that is
or actually Kemetic flower.
Yes, exactly. Okay. Kemetic flower remedies. That is so crucial for healing the emotional self. And I was driving down here today and I noticed that we have so few flowers in our community. And that is very tragic at this state of intense emotional turmoil right now, that flowers are crucial for us to be able to stay calm, to stay positive, etc. And that needs to be in all of our environments. That's just really, really crucial. And especially, okay.
Dr. Pookrum could go on and on and on and on. But what we're going to do, folks, we're going to open up the phone lines briefly and see what you might have to say. And then we're going to have to close out the show. This show could be 3 or 4 hours long very easily. Yeah, this is just scratching the surface, and we want to titillate the interest out there, as I'm sure it has been. So what we're going to do is open up the phone lines, and the number here is 404-880-9255. That's 404-880-9255. You can call us on your home phone, your business phone, your cellular phone, your car phone, your pay phone, or someone else's phone. Just call us and make sure your voice is heard. Call us at 880-9255.
We're going to need to go on a break right now, and we'll be right back. This is WCLK's Community Health Forum, and we'll be right back.
Hi, and thank you for listening to what was at the time Dr. Richardson's very popular and informative holistic, preventive, alternative health talk radio show, designed to save lives, prevent disease, and reverse disease. Furthermore, if you are interested and in need of a holistic alternative medical doctor, you can reach Dr. Richardson at 770-419-4471. That's 770-419-4471. And be sure to visit our website at acpm.net. That's acpm.net.
Hi, we're back from the break now. We do have some calls.
Yeah, we do have some calls. We're going to run right to the calls, and we do have our guests tonight, Dr. Pookrum and Reverend Jones, and we're going to take some calls. Caller, are you there?
Hello?
You're on WCLK with Dr. Richardson and guests.
Yes, good evening.
Good evening.
My name is Carlton, and I was quite taken by your show this evening. I have to plead a lot of ignorance on the topic matter, but you really piqued my interest, and I'd like to get some information on, I guess, number one, the term that you use, tell us something or another. I'm not sure that you use this type of healing, the terminology used in that, and also where can I get some reference material concerning this type of healing?
Well,
really, you can call the health hotline and request information on this subject, and we'll send you some book lists and
reference for Dr. Pookrum and Reverend Jones here.
That's right.
And but there's so much on this that we can share. But you can call the health hotline and request whatever you're wishing there.
Okay. Well, the doctor that spoke of her healing, I mean, does she have any kind of literature out or?
Oh yeah. She got
Okay.
books, tapes,
And-
videos, and like I say, call the health hotline number and say the doctor what you just said, and then we'll access that for you.
Okay, and you call this tele what now?
Psychoneuroimmunology.
I'm sorry, psycho
Neuro.
zero.
Yes, psychoneuroimmunology.
There is a term telekinesis.
Psychoneurology. Okay, and what is your health hotline?
All
number?
right.
Hello?
You're on WCLK with Dr. Richardson and guests. Thanks for calling.
Yes. Got two quick questions. On colonics, the doctor mentioned something about colonics, and I'm trying to get an understanding of colonics being positive or negative, or do they have their proper place at the proper time and proper situations?
Of course, I would think the latter is the most wise thing to say. For some people, and not often, and I would say rarely, colonics would not be for them if they had some type of recent abdominal surgery or had some serious problem with the bowel that could compromise the lumen wall. However, colonics for people in the modern world who have been eating certain types of foods and not eating properly cleansing foods could be a lifesaver and a disease preventer. So
Okay,
I
now-
think they have their place.
I'm a vegetarian, so I'm trying, myself, I don't eat any type of flesh, anything. But what I wanted to know is a good, effective cleansing method.
Yeah, I would definitely eat the high fiber diet, stay away from fried, greasy foods, even if you're a vegetarian. Drink plenty of water and take some herbal cleansing like the Dowie cleanse or fiber blend, psyllium, etc., and perhaps a couple or few colonics if indicated.
Also cleanse your mind and your spirit and your emotions through the techniques that we're talking about tonight, and you'll be more inclined to stay with what Dr. Richardson is talking about.
Gotcha. Last question. Is echinacea and golden seal, when we talk about immune system, is echinacea and golden seal a good combination, or should they not be used together?
They can be used together, and many herbal combinations have them together. Golden seal is an antibacterial and an antiviral, and echinacea is an immune potentiator, and it's been backed up by scientific data in other countries mostly.
Caller,
Right.
thanks for
I
calling.
appreciate you. I'll keep the faith.
Sure. Thank you. Next caller. Caller, are you there?
Hello.
You're on WCLK with Dr. Richardson and guests. Thanks for calling tonight.
Good evening. I've got a kind of a two-part question. One, you're talking about kind of inner healing. I want to know when you talk about like the power of suggestion versus hypnosis, is that one and the same, or are those different things?
They're basically the same.
They're basically the same?
Yes.
Okay, basically my problem is that I'm a kind of subconsciously, I'm a nail biter, and even when I have like positive anxiety or negative anxiety, I do that, and that's something I've really been trying to kick the habit. Is that something that I could use to try and influence that bad habit?
Do you know how to meditate, caller?
Yes.
How often do you do it?
No, I'm not like a regular meditator. I will meditate before I go.
That's what's missing right there.
Uh-huh.
People who tell me, I say, do you know how to do yoga, or have you taken it? You have to do it every day. Okay. You have to exercise your mind and body every day. I'd say twice a day, consistently, and then visualize yourself not nail biting, period. And then put a little cayenne pepper on there sometime.
And also read some spiritual writings that are going to take your mind to another level than this mundane consciousness in front of you.
Okay.
And also check yourself for parasites.
Okay, can I ask one more question? You're talking about healing basically through channeling energy. Are there any classes or seminars about like healing hands and things like that?
We have seminars every weekend and classes every day of the week at Emerging World Spiritual Center in Midtown.
Uh-huh.
And you can call Dr. Richardson's office to get the directions. It's right down the street from his office.
Yeah,
Okay,
just
great.
request the Emerging World's numbers, and we'll be glad to give them to you.
All right. Well, thank you very much, brothers. I hope you guys get on every Wednesday.
Thank
Instead
you.
of just two Wednesdays, I always try to catch the show, and you're doing a good job.
Thank you.
I
We have
understand.
more help.
All right.
Is that me?
You're on the air.
Okay, yes, I'd like to say thank you very much to all of you, and particularly to the doctor who shared her experiences with us. I was wondering, I've been diagnosed with a heart condition, and I was just wondering what can I do to help just 6 months ago, and I was wondering what I could do. I'm on medication. It was the cardiologist doubled it because of my chest pains and palpitation, and I find, within the last 6 months that I just find my strength draining out of me.
What was the diagnosis?
It was mitral valve prolapse.
Love. That's the issue with love.
I can't hear you.
Love. That's
Love. Dr. Polkram says
You
love.
said what?
right. Okay, well, when we talk about this from a physical, mental, and spiritual sense, the issue here is love. Any heart issues always deal with the issue around giving and receiving more love. And this has come from a fracture. Literally, we experience when the chordae tendineae rupture in the heart where the valves prolapse. This is actually a broken heart issue. Okay, so of course you need physical support.
Well, I wasn't in it. I'm not in any relationship.
No, it doesn't have to be male, female. It can be, relative, childhood, etc. Extreme, self-love and
then
disappointment.
Again, in traditional cultures, everybody was in a relationship.
Exactly.
Actually.
And with women especially, this is common.
Women. There were no single women in traditional culture.
Well, see, both of y'all talking, I can't understand.
I'm sorry. Look, you know what you really need to do? This is really deep. Why don't you call our health hotline? Come to us for a consultation or a visit, really. That would be the wisest thing to do. And
you can get books from Dr. Polkram, books of Dina, and the classes Dina gives down the street. And what you need to do is hook up with people, get in support groups, get your spirit going, their affirmations, your meditate, all the things we've been talking about tonight.
Is there a support group for people with heart conditions?
Well, there's basically support groups for everything, but you want to find the right support group, and not necessarily that you need a support group for heart conditions. You may need a support group to learn how to meditate, to learn how to forgive. There's a whole lot of issues with the heart. Yeah. Okay, caller? But we're going to have to run. Just call the health hotline, okay? All right.
Visit.
We're going to take this last call here. There's a lot of folks calling in. I'm sorry we opened up the phone lines late, but we did want to share with our guests. That was important. He's giving us 2 minutes after. We're going to take this last call. Caller, are you there?
Yes, I'm here.
You're on WCLK with Dr. Richardson. Thanks for calling tonight. Please keep your comment brief.
Okay. I really enjoyed the show, and this is the type of healing that we will need.
Yes.
In order to free ourselves instead of the revolutions that we have had in the past. And I hope the great doctors, the Imhoteps, can keep on building this, because this is definitely what we need. But I want to say, on the other hand, how people just don't read enough, because there's plenty of books around about this. One at hand, Mitu Nitu, in all the ancient Egyptian literature. All of this information. Thank you very much.
Thank you. Thank you for your energy.
Yeah, I believe that book is the Metu Neter, and it is an excellent book.
Well.
Okay, we want to thank our guests, Reverend Jones and Dr. Polkram. We really thoroughly enjoyed it, and we're definitely going to have you back if you would. And right now, we want to go on and close the show out.
Yeah, what we're going to say, too, we're going to mention a couple of things for our guest. Reverend Dina Jones has the Spiritual Center down the street from us, and the number that they can be reached at is 404-892-8202. And there's all these classes and things going on down there that we were talking about. And Dr. Jewel Polkram is here in Atlanta, and she'll be here throughout the week, and she has some lectures going on. And I thought there was one on Thursday.
Yeah,
tomorrow?
There is. At I can't think of the record shop. What's the name of the record shop on Thursday? Well, Earwax. I'll be at Earwax.